Not at all.
You're fascinating. Sometimes you know everything.
Not quite. Oh, yes. There we go.
Chat with the doctor.
You see, yeah.
The whole life I'm
Who are you trying to see? Which one? I think I must be delayed.
Yeah, oh, it's okay.
Are you all living very nearby?
Yeah, yes. Just in one show.
Really?
Yes.
So do you come regularly?
Yeah, regularly. All here.
And a good place to come.
That's right.
Yeah, the best one. The whole family come here.
Yes.
Yeah, the whole family.
Is it a big family?
Quite a big family.
Are you from Hong Kong?
Oh, yes.
Yeah, long time.
Long time now.
30 years.
Yeah, I had very happy memories of going to Hong Kong. Years.
It's years ago. Yeah,
And then
that's a
being
good
present
place.
at the Hamlet
Yeah.
in 1997.
Yeah,
But
that's
you
right.
came before that?
No,
Yeah, before, long time.
Before 1997?
Yeah,
I see.
yeah.
No.
Yeah.
Now, are you still working in London?
we start.
Yeah, yeah, all the time.
All the time already. We're 70 something.
No. I know the feeling.
Nice to meet you, yeah.
I hope you're keeping reasonably well. Are they helping you?
Fantastic. Yes.
And are you also very close in the neighbourhood?
Yes.
With all your family, are they all,
Yes.
all right?
Yeah. All of mine also here on
Really?
GP. So,
Good. So do you always get the same GP? You never quite know who you're going to get?
yeah, I've been changed on the GP like this since 2009.
It's always good to see you. Usually bad news. Well, back when.
PJ Williams, Remy.
But how long ago did you leave?
I leave, I came out, I was in 4 years ago, so 2002 I came out. So. I was in Germany, sir.
Were you? Other people break.
That's a break then indeed.
Thank you.
I know, thank you.
Then Royal Engineers. Oh, good. I'm having a struggle getting around all the Royal Engineers. There's so many of them.
Too many.
And so many sites that they're based.
Yeah, all corners of the globe.
So are you still keeping your engineering?
No, I'm not, sir. I'm now working in insurance.
Are you?
I got out last year. It's war and terrorism insurance, though, so it's out of the frying pan.
Much needed.
Yeah.
You're always still needed.
Daniel Rangers, Royal Navy.
70 years ago.
Well,
National serviceman.
really?
Yes.
Yes. It's terrifying because I was 50 years ago.
Really? Yes.
That's the real one. But are you keeping reasonably?
Yes. Practice here in God.
See, well, that's the great thing. So I've been fascinated to hear about this whole effort for veterans, which is a marvellous thing.
Alice Henderson,
Very
Nice to
nice.
meet you.
RAF.
And you're fairly close by anyway.
Yeah, 10-minute walk away, so very close.
Are you
Too
here
close.
every week or no?
Every other week normally.
And they keep you going?
Yeah, just about.
They tell me the busiest time is a Monday.
When
yes, everybody
we're
comes
all
rushing
work,
in, exactly.
so, you know.
And David Wiggins, Grenadier Guards.
Are they keeping that under control? I'm so glad. Yeah. Well, did you damage it
I
somehow?
come off my bike in Richmond Park,
Did you? God.
fractured my elbow, fractured my wrist.
Is it actually mending slowly?
I've got 3 plates in it, one there, one there, and one there.
Ugh.
So, yeah, they're dealing with it now.
Yeah, I've got endless plates and screws in my arm as well. All that's left of you when you drop dead is made in Switzerland. You see. Anyway, did they warn you of this terrible invasion? So you had a chance to jump out the window. Anyway, I'm so glad that I hadn't realised that there was this marvellous effort on specialising with veterans in GP practices, which is clearly making a big difference.
Well, I hope so. I mean, it's a little bit variable across this country, but we are trying our best to get people to be aware of it. The reception staff do ask the question. One of the vicissitudes that we have is that we don't often know, and often veterans are quite proud, and they don't really want to burden anybody else, and they like to sort it out themselves. So identifying them, and we'll talk a little about that next door with some of the families associations here as well. So there's lots to do.
But the difficulty, I suspect, isn't it, is when you leave the forces, then you're leaving that the whole sort of family of your unit and everything else, and suddenly you're left wondering what to do. I presume it says, is it a help? This must be a great help, isn't it, for you all?
It's a phenomenon.
Having this, and people to talk to about it.
I think, I mean, I joined the army when I was 19, and so I'd never registered at a GP surgery or something like that, and actually the process was so seamless. And then for the Veterans Care pathway through Old Courage, it was a self-referral on a Saturday, a phone call on a Monday, and then an appointment a week after. So the access to Veterans Health Care, certainly the initial access point from my perspective, has been phenomenal.
Is it?
Yeah. And I think there's that real sense that as you sign up to the surgery, you're asked if you're a veteran. It's individualising care to the specific needs of the individual.
So you do get that particular attention, which is the marvellous.
I've certainly noticed that.
And it's not too stressful, I hope, your terrorism and insurance.
No, walking park now. Really. Yeah, it's certainly less stressful than I think the last 10 years.
Is it in Africa?
Yes, sir. So I exclusively do Africa. Unfortunately, before the riots and protests kicked off, but we've got Addis Ababa coming up and Cairo next year, and then there'll be a few others in between. But yeah, unfortunately, I think Tanzania is that's sort of the nicer end of the places we get to go to. There aren't as many people buying war and terrorism insurance.
But it is possible to get insurance for this, is it?
Absolutely. So.
At a high premium.
Relatively low.
Relatively low.
As I tell my clients.
Anyway, are you now completely retired?
Oh yes,
For
indeed.
some time.
Yes.
So when you finished in the Paris, did you go and do something?
Yes, I did. I joined the FCO.
Oh, did you?
And I worked in various places around the world.
Really?
I think actually, sir, I came across you in Vienna.
You did a few
Years ago.
What, when we were visiting? In the
Yes.
embassy?
Yes, at the embassy. Yeah.
What were you doing then? Were you on the military team?
No, I
defence
had nothing to
team?
do with the military there. No, I was.
Are you keeping your hand in with anything now?
Well, actually, I'm the president of the Petersfield Physic Garden. But my father donated the land, which became the Physic Garden.
So this place provides a real help for you, hopefully.
Yes.
Having this sort of personal.
Well, I think it
element
is. It
to it.
hasn't really sort of kicked off yet. But it's a very good idea.
So is it very much in its...
Well, it is more in its infancy. It's been quite a primary care network, which is a group of 6 practices that share resources, and the ultimate aim is to try and combine our PCN with the next door and sort of do one envelope across Battersea, and that will we have quite a lot of look. So I'd like to introduce you to Peter Darvar, the British Holistic Medical Association.
Do you know of it? I think I do. Yes,
But,
Dr. Peter
that's
Davis,
right, yes.
many years ago.
Yes. Is he still...
Yes, we're bringing him back into the organisation. So
Do give him my best.
I will, absolutely.
So you're the chairman?
I am the chairman now, yes. So
And
I'm a layperson.
And you practicing as well?
I'm a layperson.
Oh, layperson.
Yes, we changed the constitution to allow me to do it. They needed me, apparently.
Full time?
It's a very hard-time role. It's a small charity still, educational.
I'm so grateful to be involved.
Yes, well, I'm a patient.
Oh, are you?
Yes, he is patient.
I'm so sorry. Dunford.
Open up the milkshake.
Yes,
You're
exactly.
literally not far away.
Very close. So we're hoping to do some good collaboration and support across veteran health.
Not hoping, we will.
Yes, very exciting, particularly the refugee and asylum seekers. Absolutely,
We do give them like they're still really coming.
Yes, absolutely. Yes. We're still going for that community connection. So we're making headway. Yeah.
We have and the ABF and the Legion. That's who we will apply to if we've got veterans that we're trying to help.
Well, let's hope they make a lot of nothing like this copy next week.
There's Esther Urban, who's from Thrive.
When did that start?
Since the 70s. Yeah, we've been there, yeah. So, but we have branches in Reading and Birmingham as well, in London.
Have you been involved for some time?
I started in January. So, yeah.
And what are they making you do?
So I'm the client service coordinator there, so I do onboarding the clients to our programs because we run programs through gardening to improve the well-being of
You're showing what a benefit it is for the school.
You give me a spike test. Dr. Jonathan Leach.
Hello, so I'm the medical director at NHS England Military Health. So with my colleagues Robin Simpson, Camilla, we've set up the veteran accreditation to over 4,400 GP surgeries in this network. And then also the wider things, we've got colleagues from Op Courage here. So we've set up all of those over the last sort of 12 years. So huge amount of work to actually improve the health service response to the needs of the military community.
Because otherwise it's a problem to coordinate.
So it's more making sure that people get specific support and advice, and actually, inverted commas, you'll know this as a service person, they understand the culture and the language, and the role of the college of GPs, Camilla and previous chairs, has been absolutely instrumental. And then Robin and I basically set this up and rolled it out nationally.
So are you still GP?
Still
So
GPs.
very much so. I served 35 years as an Army GP. And now, as Jonathan said, run the programme educating GPs in England about that simple question, asking their patients, have you ever served? Have you ever served in the armed forces? If you ask that question, the veteran will tell you everything. If you don't ask the question, they won't tell you anything. So that simple question makes a big difference, and we're totally supported by the college. So we've got 72% of our practices in England are accredited, and there's a real interest in making a difference. So it doesn't cost much education, and it makes a difference.
So just as an example, last night Robin was on a webinar about gambling in the military community, and this was open to all GPs, you know, so that you ask about whether or not they're a veteran, but then actually understand that, for example, there are all the different pathways which are more specific and available to them.
But do you get still quite a lot of post-traumatic stress?
So absolutely, unfortunately, you know, in the general population, compared to the general population, veterans are more likely to get PTSD. It's not the biggest issue, but it's a major issue, and unfortunately they won't present to the GP saying I was in Afghanistan and got PTSD. They'll present saying I've got a headache or I'm tired all the time, and the GP's got to ask that question, well, did you ever serve in the armed forces? And then they'll tell you everything. So PTSD is...
GPs that would learn an awful lot.
We do.
Well, but just that one question, have you ever served, will be the clue. Yeah.
And that's my role, was to make sure that it's embedded and becomes part of
It's in the curriculum for all GPs. All GPs, that's their qualified.
55,000 members, they will need to
You cram it all into that. There's so much. It's like adding to the school curriculum.
Yeah. Well, the thing is to know where to look for stuff. You don't have to know everything.
Because after a bit you get to know.
One of the things we've been a bit sneaky about is we put it in their exams. So the trainees know, you know, whether they're interested in veterans or not, they've got to know the stuff because it's in their exams, so that's good, yeah.
But if it's that one question, that makes a big difference.
Absolutely, or even if they think that it might be there, they'll have to learn the stuff.
It took a long time because I discovered how much there was of PTSD in the parents and guards, and that was when I realised that nothing was happening.
There was nothing then there.
That's exactly right, and I think that we've learned from that it took 20 years for PTSD to be diagnosed. But it's the Falkland Islands experience has influenced as what we do now.
It's Jarvis of the Women's Female Professionals Foundation.
So it's not, but our job is to make sure that services have a better understanding of female veterans and their needs. But also historically, I did social prescribing for the veteran community. So, I know you have a keen interest in social prescribing.
It's incredible to show that you've invented it.
Absolutely amazing. She really led the way with social prescribing.
And it really is helpful.
Oh, amazing.
So many different ways.
Incredible stuff.
Because you need to understand military culture, and that makes a difference.
Yeah, female veterans transformation program. So she's the elegant swan, and I'm the gobby Rottweiler veteran. To both military and civilian, and the NHS, and created a toolkit.
So how long did you do it?
I did 19 years before I got medically discharged there.
Did you?
Yeah.
As a which department?
So I was Royal Air Force, police.
Police?
Yeah.
Oh,
I didn't get used to that.
nobody hit you over the head.
No.
No. You're managing all right now.
Yeah, I'm doing good.
Phil Hall from Bristol.
Yeah, so basically, I suppose carrying on from the conversation over there, we're there to really help those GPs to engage into secondary care NHS services. So,
So sorry, you've been dragged in.
We've got some very keen, enthusiastic senior sixth formers from Trinity, all considering a career in the armed forces.
You're all from Trinity?
This year. We're actually 110 years old, but nobody noticed in 2015. So we're using it as an excuse to have a bit of a celebration and what have you.
So when do you, is it on a, when do you do the CCM? Is it on a Wednesday?
On a Monday.
Monday. So I didn't interrupt that one this week. No. And after school?
Yeah.
And what sort of things do you get up to?
All sorts. Usually it'll be like syllabus training or field craft training, so that way when we go on a trip or exercise, they're prepared and what to do, yeah.
Do they take you to any obstacle course?
Yeah, every now and then, yeah.
You haven't taken you to the one at Sandhurst, I think?
Not yet, unfortunately, but...
That's quite serious.
We'll try and get a good dinner.
Which one are you on?
The RAF. But I've always wanted to be a pilot in the RAF, so yes.
Since you were quite...
Yes, since I was quite young, yeah. Top Gun man.
I got to get on with it, because otherwise it will be unmanned.
Yeah.
And which subjects do you particularly good at?
I'm pretty quite like STEM subjects, so I'm thinking of going to engineering and space.
You're going to
Yeah, I'm not quite sure yet, but I think intelligence is what I'm leaning towards in the army.
They're shutting down places like Chicksa. And you're also
We've just come for a second round.
Anyway, I'm causing terrible disruption to
Yeah, we're all striving for a senior child.
It's not quite lunchtime.
No, it's not.
Do you get a lunch break?
We do, but this is, you take it now.
So are you all in this building? Are you? Are you all in this building? Are you all living room?
Yes.
Yes,
Just
you
have a
are.
look. Just where you
You're a great model.
Yes.
Latest adaptive violin. Do you want to shake Chris's hand? Thank you for supporting Ukraine. Thank you. Thank you so much. Say hello. You're wonderful. This is Leif, and he is the Prince of Battersea. Can we have a picture? Bless you. He is the biggest royalist you'll ever meet, and we tell stories about the King and the Queen every night before bed. Leif, it's the real King! Can you see?
Almost definitely. Lovely to meet you.
It's a pleasure. We live there, but... Do you want to shake his hand?
Can I shake your hand now?
Thank you very much. Your hand.
Thank you, sir.
Leif, can you shake Leif's hand?
Thank you very much.
Thank you so much.
God bless you.